we're going to look at House 2397, Senate 1593, an act establishing a nursing workforce center. And I'd like to welcome the panel, Silda Mello, President of the American Nurse Association, and Jay Prosser. Welcome.
Thank you.
Thank you. Thank you, Chair Decker and Chair Driscoll, and members of the Joint Committee on Public Health. My name is Silda Mello, and I am the president of the American Nurses Association, Massachusetts. ANA Mass is a constituent member association of the American Nurses Association, which advocates on behalf of more than 5 million nurses nationwide. ANA Mass represents the interests of the Commonwealth's more than 130,000 registered nurses. We are the largest voluntary professional nursing organization in the state, representing nurses who practice in settings ranging from acute care to community health, from the bedside to the boardroom. We respectfully submit testimony in support of bills H2397, S1543, An Act establishing a nursing workforce center. An act establishing a nursing workforce center is crucial for ensuring the long-term stability and support for nursing resources in Massachusetts. The Commonwealth prides itself on being at the forefront of healthcare delivery, yet there are 45 other states which already have permanent nursing workforce centers. It is time that Massachusetts codifies the work currently being done by the Nursing Council on Workforce Sustainability and commits to the largest healthcare workforce in the state. The mission of the Nursing Council on Workforce Sustainability is to convene key stakeholders to provide innovative solutions, inform policy, and make evidence-based decisions that ensure health equity by building a resilient and sustainable nursing workforce focused on improving the health and well-being of the Commonwealth. The Nursing Council has made significant progress in creating and maintaining an accurate picture of the nursing resources in Massachusetts and identifying the needed changes to secure a sustainable nursing workforce. However, it is not a permanent entity and is subject to an interagency service agreement between EOHHS, Health and Human Services, and the EOLWD, Labor and Workforce Development, and flows from the Nursing and Allied Health Trust Fund. Given the current environment and uncertainty of Medicaid funding, there is concern that the $1.2 million per year will be diverted elsewhere. Several other professional organizations have also signed on in support of this bill, including the Massachusetts Association of Public Health Nursing, the Organization of Nurse Leaders New England, Hebrew Senior Life, and the Massachusetts Coalition of Nurse Practitioners. The legislature has a duty to ensure that there are an adequate number of nurses and caregivers to support the aging and diverse populations of the Commonwealth. Failure to maintain and strengthen the nursing workforce affects the entire healthcare ecosystem, and the economic impact of forging multiple pathways into the profession and encouraging entry into the profession as a strategy to raise individuals above the poverty line is strong. We have to have a longer perspective on return on investment when considering the nursing workforce. It's today's kindergartners who will be taking care of us as we age. How do we inspire them to become a nurse and provide them with the education needed to pursue nursing as a profession? That's the work of a nursing center, workforce center. Our written testimony gives some further information about the data that the Nursing Council was instrumental in analyzing to more accurately reflect nursing vacancy rates, demographics, future supply of nurses. It is critical that ongoing collection of data mandated as nurses renew their state license continue to be analyzed under the auspices of the Nursing Council on Workforce Sustainability to identify trends in nurse supply and employment plans. This work must continue in a sustainable way without the continued threat of funding loss. This is why we implore the Joint Committee on Public Health to codify a nursing workforce center. It benefits all Massachusetts citizens directly and indirectly, and enabling the state to thrive and continue the excellent health care for which we are known.
Good morning, chairpersons and members of the committee. I'm Dr. Jay Prosser. I'm the Executive Director of the Nursing Council on Workforce Sustainability. I'm submitting my testimony to you, so I thought I would just have a conversation briefly with you about the remarks in my testimony. As a nurse for over 20 years, I can tell you that healthcare cannot function without nurses. And when I speak about nurses, I'm talking about LPNs, licensed practical nurses, that treat very diverse populations. They are the backbone of long-term care and rehabilitation in Massachusetts. Registered nurses who are most familiar with, who practice in both clinical settings and hundreds of positions, as well as non-clinical as nurse leaders and educators and many other things, even like me as a workforce individual. But also APRNs, advanced practice nurses, who as practitioners can help bridge the primary care gap that you've heard about earlier in Massachusetts because they are providers. They can bridge the mental health care gap in Massachusetts because they are providers. They also can practice in acute care. But I'm also speaking about unlicensed personnel like CNAs and medical assistants who, with the proper support, can become the nursing workforce of the future. But I'm also talking about high school students who can be apprenticed into nursing healthcare workforce roles and upon graduation enter into the healthcare workforce. We've done a lot of work as a nursing council. We work under the direction of EOHHS, and we live in the Fort Health Department in UMass Chan Medical School. Our structure is unique because we only have 2 full-time individuals, and we function with hundreds of volunteers that are cross sectors of individuals that actually work in healthcare, and this is the reason that our work is so valuable. I want to tell you briefly 3 things that I'm most proud of. We're working to bridge the gaps in those social determinants of academic success. Massachusetts is fantastic because we pay for free community college, but it's not enough. Would you like me to stop, or may I continue? Yeah, very quickly. But it's not enough if these students can't graduate. So we are creating programs that can be replicated, that can help these students and empower these students to be successful. Secondly, nursing apprenticeships. We're establishing both practical nursing apprenticeships and apprenticeships for registered nurses that we will help register through DAS, and we're making this as a replicatable situation so that anybody can come to us and we can help you set up a nursing apprenticeship. So what we're asking for is that we become the Nursing Workforce Center, and we're not asking for any additional money. We're just asking for this year's budget to function is what we're asking for. So I appreciate the testimony opportunity, and I'll be submitting that in writing with further remarks.
Great. Well, thank you both for your testimony and for your work.
Thank you so much.
Thank you. Okay, this time we're going to move on to House 2396, Senate 1535, an act relative to safe